So for rhinoplasty, with or without septoplasty, there are risks for the surgery. Other than the general risk of bleeding, infection, and wound complications, if you have a bump on your nose, there's a risk that the bump is going to still be there afterwards, or it's going to come back, there's also a risk that it could be taken down too much. You're going to have a fair amount of swelling, which is to be expected. You can have difficulty breathing after the surgery. That can persist for a while. If your nose was crooked, there's always a risk of recurrence that can come back. Tip definition, when we're doing tip definition surgery, there's a risk of recurrent fullness as well. There's a risk that it can be over-refined. Also, sometimes when the nose has to be broken, you could develop some bony spurs there. So these things are rare, but they can happen. Generally, these procedures go without issue, but expect that it's going to take about a year to a year and a half for all the swelling to heal. You're going to generally have a scar at the base of the nose, which usually ends up being imperceptible. If the nostrils are narrowed, you'll have scars in the shadows of the base of the nose. Again, those are usually imperceptible, but sometimes they're noticeable. So those are the risks of rhinoplasty and septoplasty.